So let's talk about migraines. Now, if we're going to compare headaches to migraines, a headache is like a light storm, and a migraine is like a category 4 to 5 cyclone coming through on people. Traditionally, it's in one point, either behind the eye in the temporal area or somewhere on your head. It's a real throbbing pain, it's really intense. Nausea and vomiting is quite commonly associated with it, a light sensitivity and visual disturbances, as well as a sound sensitivity. So most people want to pull the curtains, shut the doors, jump back into bed and try to sleep off their migraines. Different people have different triggers again. It can be stress related, hormone related, foods and drinks again can be culprits, and even in some people, unluckily, exercise can do it to them. Now, most people, or not everybody, will get a warning sign, what they call an aura. That's a visual disturbance where it looks like a halo effect, or stars can be appearing in the visual field. That's an indication that they need to take something as soon as possible to hopefully prevent a migraine from kicking off. Some of your OTC type medications can be quite helpful in these early stages, like aspirin and Voltaren. Panadol will work for some people. There's this device, or this little migraine stick, that can be helpful. Again, if it's just in a spot that you can feel it coming on, that can be quite relieving for some people. It doesn't work for everybody. Now, obviously, treatment options for nausea and vomiting. You can talk to your pharmacist potentially about those when it comes to migraines, so have a chat to them about a potential treatment you can get from a pharmacist. Your next step obviously is from the doctor. The doctor can give you something that you can take every day to stop you getting a migraine. There are prevention options available to you if you get frequent migraines, and they also have acute medications that they can use that are normally in small packs. They come in obviously tablets, nasal sprays and wafers that you can use. When the migraine is starting to kick off, you can hit them then and hopefully the migraine won't occur at all. Botox is another option for some people. Again, it's not designed to get rid of your wrinkles or anything along those lines, but paralyze the muscles there that are tensing up and causing you to have a migraine. So in general, you should be able to talk to your pharmacist about something for your migraines. If they aren't working, have a chat to your doctor about a daily medication you can take that they can prescribe to help you prevent getting your migraines altogether. So there are a lot of different types of migraines within the migraine families as well. I recently helped somebody out with a condition called hemocranium continua. Now it responds to a very specific medication that a doctor can only prescribe. So if you're finding that one doesn't work for you, keep going back, keep trying different options, and you may find that a different drug will work for you to prevent your migraines or stop them in their tracks. It isn't something that you should hopefully have to live with. Medication should be able to help. Obviously, if you're not getting any relief, hopefully the doctor is referring you to a neurologist or a specialist to dig a little bit deeper into things and hopefully can find the cause of the problems and stop the frequency of the migraines that you suffer.